All right, a warm welcome. It is Sunday evening in Geneva, Switzerland. Good morning, good afternoon, good evening. We'll be starting in just under 3 minutes. And at the top of the hour, the two teams, the two alumni from Ghana and from Cameroon, alumni and team members actually of the COVID-19 Peer Hub, are going to be coming together to share, this time in private, what they have been learning about COVID-19 vaccine introduction. And so what we wanted to do, maybe it'll be a 10 or 15 minute update. We wanted to give members of the Peer Hub from other countries an opportunity to hear a summary of what happened of significance during the first inter-country meeting between Ghana and Cameroon that was held on the 2nd of May 2021. So warm welcome to Amel, Mutwali, Mesret, Matendrick. So we will be coming back in 2 minutes. It'll be short. We'll get to the point. We'll look at what were the main takeaways. And with us is Martha Ngoe, team leader for the Cameroon COVID-19 Peer Hub team. So we're looking forward to hearing from her and hope that the connection will be with her. See you soon. Warm welcome to you. We're here. It is Sunday evening in Geneva, Switzerland. I'm Reda Sadki from the Geneva Learning Foundation, wishing you a warm welcome. We are 30 minutes away from the second inter-country rapid learning meeting between two teams of the COVID-19 Peer Hub, a platform launched in response to the consequences of the pandemic on vaccination, on immunization services in over 90 countries. We've been last week on the 2nd of May, the first meeting between the two teams of alumni from Ghana and Cameroon of the COVID-19 Peer Hub was held. And with me, of course, is Charlotte. Charlotte, how are you doing?
Hi, Reda. Hi, everyone. I'm doing great. Thank you.
All right, so we have, of course, with us the team leader, Martha Ngoe from Cameroon. A warm welcome to you, Martha. I hope that the connection will be with you this evening. Are you able to speak to us?
I hope so. Thank you, Reda.
All right.
Yeah, good evening. I hope to the connection will be coming this evening.
So this is a quick update.
Welcome to everybody who is joining us.
Thank you, Marta. And this is a quick
Yeah,
update
go ahead.
before the two country teams meet this time. For the second time, they're going to meet in private in order to really enable a candid conversation between practitioners. And with us as well is Obed Philip Nuobe from Ghana. So he is one of the most active alumni of the COVID-19 Peer Hub in the world, and also one of the most active ones, along with Marta, I must say, in Ghana. Obed, a warm welcome to you. We're looking forward to hearing your thoughts, reflections a week after the first meeting that was shared publicly. Everyone can go and look at it, listen in. How are you feeling tonight, Obed? And
Hello, Rita.
yes, we hear you loud and clear.
Yes, thank you very much. Good evening to everyone. And I'm happy to be here today for this second session of experience learning with our counterparts from Cameroon. And in fact, we thank Geneva Learning Foundation for the opportunity afforded us to be able to share these experiences. We are learning a lot. A lot of people call us and said, in fact, they never knew some of these things are even there. So, Rita, thank you very much. We are ready to carry on today's session as well.
So
Thank you very much.
That's great to hear, but I have to emphasize that in this case, this series of meetings was prompted by country teams, of course, with support from Charlotte. But I want to stop here because again, this is ahead of the meeting between the two countries, and we have a number of people. We wanted to make sure that people who are not from Ghana, not from Cameroon, could get an update, and that's what we're doing today. So many of our most loyal followers on Facebook, such as Amel El Tahir from Kingdom of Saudi Arabia, Mutwali Adam from Sudan, but also new people, Mesret Degefa from Ethiopia, Matendrik Adolf from Haiti. And Amel says she's eager to hear more informative and educative feedback from Ghana and Cameroon colleagues. Yes, again, there are people listening in all over the world. This second meeting is going to be private, but that's why we're providing this update with key people from the Ghana and Cameroon team. Mercy Onu Peters, wishing you both an awesome deliberation. Mohammed Imran Qureshi from Pakistan. Emmanuel from Nigeria. Christopher Ibanga is present. All right. Thank you, Christopher, for letting us know. Dr. Iwat Ndayo from Abuja, and Nurse Ismail Nasiru from Kano State, also Nigeria. So great to have you with us. Now, let me just say a couple of things about the how we at the Geneva Learning Foundation, the event starting at the top of the hour is really by and for the country teams. And we see these country teams as voluntary groupings of national and subnational immunization professionals who've completed one or more immunization scholar courses offered by the Geneva Learning Foundation in partnership with WHO or other organizations, whatever the case may be. And both the Ghana and Cameroon teams are meeting on a regular basis to provide mutual support, learning, working to support the national EPI teams as part of the EPI teams to help achieve their country's immunization goals. So we had a first event hosted by Dr. Daniel Assomaning, who's the Ghana country team leader, and Dr. Martha Ngoe who's a Cameroon country team leader. It was live streamed everywhere and attended by more than 200 immunization professionals who were with us in the Zoom studio. Speakers included the National EPI Manager of Ghana, Dr. Kwame Mponsa Akiano, and the Deputy EPI Manager of Cameroon, Dr. Enjo. Now, I want to go to Obed Philippe Nuobe from the Ghana team, who hosted this initial meeting that took place on the 2nd of May. 1 week later, Obed, what are your thoughts? What's your main reflection? What for you happened last week in this meeting between the two countries?
Hello, Rita.
Yes, Obed, please go ahead.
Yes. I think the meeting last week was successfully organized, and when you look at the experiences that were shared, they were very specific to our country context. The issues that came up were things that were already known to the general populace how we were trying to ensure that vaccine hesitancy issues were addressed right from the national level to the district level or municipal levels. And for me, looking at the experiences that were shared last week from the country manager, Dr. Amponsan Achiano, you could see clearly that, yes, we at a point in time, we had issues that has to do with vaccine hesitancy, even among health workers. But we try to re-strategize the entire system to make sure that we were able to have a very high coverage among the health staff. So even our own health staff, there was a need for us to look at it carefully. So going forward to the general population, we saw that we need more specific and strategic activities or coordinating with other stakeholders to be able to achieve this. And it should be intentional, well organized, else we will not get the coverage that we expected. Even when we started with the other population, the other at-risk populations and then health workers, we saw some issues, but we were able to handle them in a very nice way. And we got the vaccinations. In my area, for instance, like Dr. Achano indicated, we were able to vaccinate all the target groups. Our vaccines got shots. So you could see that strategically, if we plan it that way, going into the general population with these experiences, we'll be able to have a very good coverage. Thank you very much, Rita.
Thank you, Obed. And indeed, so what we learned last week, what I learned, was that Ghana was, experiencing a COVID-19 positivity rate of 8.4%. That's after having carried out 1.1 million tests, with the vast majority of cases centered in the south of the country, around the two major cities, Accra and Kumasi. Cases were currently decreasing, we were told. So you described how the Ghana EPI team had worked with partners to address vaccine hesitancy, and you described we heard very many other issues from the people who are actually carrying out vaccine introduction. So Martha Ngoe, you are the team leader for the Cameroon team. What did you keep? What did you take away from last week's exchange between Ghana and Cameroon? And again, we're 22 minutes away from the second exchange, which will be private. And so we wanted to give people from all countries an opportunity to hear firsthand what you've been learning through this kind of exchange. Martha?
Thank you, Reza. Thank you, Obed, and thank the Ghana team for hosting us. I really want to say it has been a good experience. It has been a good interaction and exchange, because we did not just come to waste our time, but at least at the end of the day, the EPI managers and the others from the central level were present, could acknowledge a fact in the presence of everybody that it was indeed a very important session. So from what I can take back, Obed just talked about specificity of the challenges for their country. I don't think it was really specific. Most of what they highlighted from the questions you could get during the session from Cameroonians, you realize that they cut across the two countries. And I believe it's also similar to some other countries who are introducing the vaccine. So for example, hesitancy among healthcare workers. We are just 1 month into introduction of the COVID-19 vaccine in Cameroon. The hesitancy among healthcare workers is right there. And from the lesson learned from the last session, we have realized that there is much to be done. And from what we have learned from Ghana, in order for us to have these health workers get vaccinated. Also, from the aspect of communication, we saw that the communication was really targeted with the help of partners from for Ghana, from what we learned. And so I think from the central level, they could acknowledge that target communication is one of the most important things that came out of last session, which will make this vaccine rollout in Cameroon to really be successful. Another thing that we took out from this was AFI surveillance, adverse effect following immunization. We saw that we learned from Ghana that they use so many platforms to capture data on that. which is not the case in Cameroon, but we hope that in the days ahead, from what was learned from last session, so much will be done. And we saw also that Ghana, they were not hesitant to report this AFI, but in Cameroon, it is the rate of reporting is very low. So I think we go back. We have already encouraging our immunization staff at the front line to not to resist to report this AFI, but it's just for pharmacovigilance, and also it's very important to know about what is happening on ground. I think it was a very successful and educative interaction. And I don't think any country that has to learn from another country will be that reluctant from all what we gained from last session. Thank you so much, Reda.
Right, I think that calls for some applause to hear such a success. What sounds like a useful. And Marta, if you're saying it's useful, you're one of the people in Cameroon, of course, who's involved with COVID-19 vaccine introduction. Immunization staff. This is a common effort. So it is heartening to see that this exchange is productive. We learned last week that the first phase of rollout targeted healthcare workers in Ghana, frontline security workers, people with known medical conditions, and frontline service providers in 43 out of 260 districts. So as of last Sunday, nearly 900,000 vaccines have been given, and that's about 4.5% of the population. Now, 90% of health workers have received the vaccine, so that's I believe that was one of the successes that Obed was referring to. Everyone who's been vaccinated in Ghana has been tracked and received a vaccination card. 4.5%. And just, of course, we are seeing other countries that also received doses from COVAX, so the Gavi program that aims to deliver 2 billion doses by the end of this year. And progress has been very slow, to the point where we are hearing some global health immunization experts who are asking serious questions. It's saying it's too slow for to reach a useful coverage, unlike the situation in Ghana. So I'd like to ask Obed, what is making the difference in Ghana in terms of this one thing, the velocity, how quickly vaccination is happening? And I know you are not, you are not here in an official capacity. You are not speaking on behalf of the Ministry of Health, but your perspective as a health professional, what do you think is the Ghanaian recipe, or what are the ingredients that come to mind from your perspective, Obed?
Rita, sorry, I think the connectivity was a bit breaking, so I didn't get the question clearly.
Yes, I'm asking, in other countries, vaccination for COVID-19 to protect people from COVID-19 disease has been very slow. It seems to be at the right, on target in Ghana. It seems to be going very quickly. What is making the difference in Ghana how could other countries learn from that?
Okay, thank you very much, Rita. I think I started by indicating, like PM, the program manager indicated last week, we did a lot of communication. In fact, we employed almost all the available communication channels were used and well utilized. And the second one was stakeholders collaboration. It was very effective. And you could see when we started the rollout, key top officials were first vaccinated. Even when we came to the district level and were doing the vaccination, we brought in some of the religious top leaders, to vaccinate them. These are all measures to make sure that people buy into it. In the health facility where the vaccination went on, the key stakeholders of the facility, for instance, the medical superintendent, the municipal health director, were the first people to be vaccinated. And that gave the morale to the other staff to be able to go ahead. So I will look at it in the area of two, that is communication and then stakeholders collaboration. And with the communication, there's another aspect that we tried handling very seriously. That has to be the misinformation aspect of it. We have to tackle it very well and appropriately so that these things are not in the minds of people. That is how we're able to move with it. And you can see that it's very, people are even asking, when are we going to take the second dose? They are ready. You can see that they are yearning for the second dose of COVID-19 vaccine. So that is what I'll say, Rita. Thank you very much.
Thank you, Obed. I just want to say to Mesret Degafa and others who have, so she says, I want to raise a question. Please put your question in the comments. I'm reading all the comments now. Again, just to explain what we're doing for another maybe, I think 9 minutes, we're really getting the update about since the first meeting, because the Ghana and Cameroon scholars, so members of the COVID-19 Peer Hub, are going to go at the top of the hour into a private meeting. So they will be meeting this time privately. You can learn a lot about the exchange that happened on the 2nd of May, because that one was public. This time they are meeting in private to really allow health professionals from both countries to share candidly the reality of the situation, the challenges, and what they are doing about it. Just to share with the Ghana team, this is Amel El Tahir who is based in the Kingdom of Saudi Arabia, who says, I'm really amazed by Ghana team since their presentation on how EPI coverage was significantly improved, and now the way COVID-19 vaccination is going. You are doing superb work. Keep going, she says. All right. I want to turn to my colleagues, Charlotte Mbu and Ian Steed as well from the Geneva Learning Foundation, who's joined us as well. Ian reviewed and analyzed what was said in the meeting on the 2nd of May. So perhaps I'd like to turn to him and to ask if he has any follow-up questions since the 2nd of May meeting, or if there are key insights that he saw in when he listened to the meeting that may not have been obvious. And I hope, Ian, you're able to speak to us.
Good evening, Raider. Good evening, everyone. Can you hear me well?
Loud and clear.
Excellent. No, I mean, just to echo the comments that have just been made about what an interesting session this was. And for me, one of the things I found really exciting was it was fantastic to hear from the Ghana EPI manager. I think that's a real honour to be able to hear from someone with such seniority in such a meeting. But I thought the compliment with hearing from Dr. Ruth Alota from the teaching hospital, giving us real detail about how they had managed that process of vaccinating staff and bringing that real detail into it was fascinating. So we heard the big picture, but we also heard a huge amount of detail about the practice and what had made things successful. So that was one of the things I really took from that call.
Thank you, Ian. And indeed, there was a fascinating story. Now you can go and listen to this story on the Geneva Learning Foundation's social media platforms. I'm showing YouTube here, and you can see here. So this is being shared live, and some of you are connecting from YouTube. But if you scroll down and you go to the past live streams, you can see we're quite busy. There's a lot of short events that are happening, and you can see the Ghana and Cameroon intercountry rapid learning is right here. So if you want to go and look at the full picture of what happened on the 2nd of May, please go ahead and do that. You should be able to find it. And just for those of you who are joining us for the first time, this is really an outgrowth of the COVID-19 Peer Hub that thousands of immunization professionals started last year. So we have 5 minutes left. Charlotte, I'd like to go back to you. Is there someone from either the Ghana or Cameroon teams, in addition to Obed and Marta, that you'd like to either ask a question or share comments from before we go into the private meeting?
Okay, thank you very much, Reda. And already I want to thank Ian for joining this evening, as well as Obed and Martha for what they have shared so far. So we have the honor once again to have with us here Dr. Njo Andrea Sateke, the Deputy EPI Manager from Cameroon, and it will really be great for us to hear from him. The one takeaway, Dr. Njo, if you can share with us from last week's session, the one key takeaway that you took that you think could be very useful for the Cameroon national EPI team to use to ensure a successful introduction of the COVID-19 vaccine?
Thank you so much, Charlotte. I think one major thing I got from last week's session is really the use of every possible medium to transmit information to ensure that the population gets the right message such that they can all get vaccinated. I think this is an item that even during our interagency committee meeting, we realized that we had some limitation in the channels that we used. And so between that period and now, we have increased and improved upon the channels we use for communication. We are hoping that with this, we are going to make some progress, especially after the current ongoing vaccination campaign against poliomyelitis in Cameroon. Thank you, Charlotte.
Okay, thank you very much, Dr. Njo. And I think before I hand over to you for closing, Reda, I just want to turn towards Martha and ask Martha, what are your expectations for tonight, for this second session?
Charlotte, thank you so much. My expectations for tonight, they are not as different as from the very first meeting. We are hoping that the more that we share the experience, especially as Cameroon, will be sharing what they have been doing through the deputy EPI manager. We are going to have some insights of what can help in better the rollout in Cameroon. So I know that we will not leave the place the same way that we started here again today. Thank you so much.
Thank you very much, Martha. Reda, over to you.
All right. Well, I think this is, we've got 2 minutes left. So I'm just going to express our gratitude. Those of us from the Geneva Learning Foundation who've been involved with the COVID-19 Peer Hub are learning with you and from you. And these two events really illustrate what a difference it can make when it is people from countries, from EPI, who are leading the learning, who are learning leaders, in a time of crisis, taking time to learn from each other. Now we also have KCAS Tech listening from Texas in the USA, so you can see there is an international audience here. As I said, we're going to close this this update. We wanted to update people from countries other than Cameroon and Ghana, and of course in the room we have participants, members of the COVID-19 Peer Hub from both countries who are now going to go into a private exchange. So once again, thank you. I'd like to, for all really health workers, immunization professionals who are right now, who have been on the front lines, helping with recovery of immunization services, making a difference. I've written and I asked myself, and I formulated it as a question, hoping it wasn't an exaggeration to say that people who deliver vaccines are literally saving the world by doing so with COVID-19 vaccines. So in that spirit and with that thought, we're going to go into the next the private segment of the meeting. Thank you and goodbye.